Good afternoon, and welcome to this virtual program co-presented by WorldOregon and the Oregon Historical Society. Today's program is What Can We Learn from the Influenza Pandemic of 1918 to 1919, presented by Christopher McKnight Nichols from Oregon State University. Professor McKnight Nichols is an associate professor of history at OSU, where he also directs the Center for the Humanities and leads the Citizenship and Crisis Initiative. He specializes in the history of the world and its relationship to the rest of the world, with a focus on isolationism, internationalism, and globalization. Professor Nichols is the author of Promise and Peril, America at the Dawn of the Global Age. And in 2016, he was named one of 33 Andrew Carnegie Fellows worldwide. He's also been elected as a permanent member of the Council on Foreign Relations. And as I mentioned, he is on the board of the Oregon Historical Society, which is a close partner of WorldOregon, as we are co-located and share many programs together with them. A couple more notes before we start. I would say this is an extension of our strong partnership, not only with the Oregon Historical Society, but also with Oregon State University, who is a strong supporter of WorldOregon and has a trustee on our board of trustees. And it's another way that we are closely participating together in educating the community and engaging the community. So it's a real honor to have this presentation today. As I mentioned at the beginning, you can ask questions through the chat room function. After the presentation is over, we will begin to raise Q&A, and then I'll come back on at the end, and the program should wrap up by 1 o'clock. Without further ado, I'm going to pass it over to Chris. Thank you.
Thanks very much. It's excellent to be here with you all. First and foremost, I wish we could be together in person in health and normalcy, but of course we can't these days. So this is our best option, and I hope you'll enjoy and learn a bit and that you'll engage through the Q&A questions. This is also a great time to subscribe, I'd say, to WorldOregon's listserv, and also the Oregon Historical Society's listserv. Both are doing really great work, virtual work. As you may have been involved with just a few days ago, on Tuesday, there was a COVID-19 program, a virtual one through WorldOregon, and both organizations are building on similar themes to provide exciting and relevant new programming, and some programming that frankly is a good diversion from the world we're living in today. So what I'm gonna do in this talk is walk you through two pieces. Well, the bulk of it will be sort of explaining the history, telling the story of the influenza pandemic of 1918 and 1919. And then the end will be a sort of global wrap up, global in the sense of thinking worldwide, and what was to come after the pandemic, and also thinking about specific lessons learned from what we know of this history. And here at the outset, I would say I'm a scholar of the era. I've written on the influenza pandemic. I'm a scholar of the Gilded Age and Progressive Era, World War I. I co-edited a special issue of the Oregon Historical Quarterly, which dealt with the World War I era. But I'm also relying on lots of great scholarship. So at the end of this talk and at the end of my slides, I have some recommended books and articles and resources. There's some really fantastic material out there that I'm relying on here. So as we go, I will show you some fantastic images as well. And I'm sharing right now those slides, starting from the beginning here. So here I am, here's what we're up to this fair day. What can we learn from the influenza pandemic of 1918 and 1919? So first off, I want to start with thinking about the human costs and why it matters that we think about this moment. Here we see Victor Vaughn, who becomes Surgeon General of the Army. He's the University of Michigan Dean of their medical college. When he steps in Boston in fall 1918 and sees the ravages of the influenza, he is struck. It's like nothing he's ever seen before, even though he's treated flu, smallpox, and other kinds of diseases. And here's this really moving quote. "They're placed on the cots until every bed is full, and yet others crowd in. The faces soon wear a bluish cast. A distressing cough brings up the blood-stained sputum. In the morning, the dead bodies are stacked about the morgue like cordwood." This is precisely what the US and the world are trying to prevent today in 2020. And so if you think about the human costs of 1918 and 1919, the economic costs, the societal costs, they were enormous. If you need some references, or if you want to think about a reference there were something like 20 to 30% of the world population was infected in 1918 and 1919. The studies vary. The usual numbers that are cited for total deaths are 20 to 50 million. The highest number that some historians and epidemiologists cite is 100 million people dying. The lowest numbers are in the 17 to 20 million in the global population. If taken in somewhere in the middle, in the sort of 50 million mark, which is what most historians seem to agree on, you're talking about deaths that were more than the Black Death in the Middle Ages, more than everyone killed in World War I and World War II combined. If you're thinking about the US case, the numbers vary a bit as well. And this is something I would think is an insight that we should also consider from this moment, which is how do we count these deaths? If you're someone who dies from influenza-related disease or COVID-related disease, comorbidity, what if you die of a heart attack because an ambulance can't get to you? Does this count as an influenza death in 1918 or 19? Does it count as a COVID-19 death in 2020? Public health has come a long way, but these are not semantic questions, but they do matter a lot in terms of how we think about the data. So in the US, roughly 675,000 Americans die, and the largest swath of them died just in fall 1918 in a terrible, brutal second wave of the influenza pandemic. This amounts to about 0.66% of the American population, a population that numbered roughly 103 million. So let me walk you through, in very brief, the history of what happened in 1918. Epidemiologists, historians, public health scholars tend to agree that the influenza that we think of and that was once termed the Spanish flu actually developed in a mutated form in Kansas, perhaps Haskell County, Kansas. Here's an image of the emergency hospital at Camp Funston in Kansas. As John Barry writes, a soldier recalled that 12 of the men who slept in his squad room, 7 were ill at one time. The first moments of the flu were March 1918, and it moved rapidly through American military bases. So the US joined the war in April 1917. It only barely began to muster troops throughout 1917. The first troops arrived on the Western Front in 1917, but the largest numbers of American troops move abroad in 1918. So you've got large military induction camps, you've got rail lines moving across the US, and you have troop transports and material transports going not just to Europe, but around the world. These were precisely the kinds of conduits that would lead to global transmission. So it crops up in Kansas, in a small county, and at this time, influenza was not a, quote, reportable disease. So public health officials immediately start waving what you might call a yellow flag, that this seemed abnormal, that this wasn't the normal common cold or even flu of the era. But the reporting went relatively unnoticed until it started to affect induction camps and military facilities in the US. And this is one of the reasons why we have such good data from this moment. So if any pundit or politician that you hear says that there isn't good data on pandemics of the past, either how they might be treated or the numbers, they're wrong. This is the best data set we have because we have the US military tracking very closely the combat effectiveness of troops, and you can watch the transmission spread through both, in particular, through military documents and US government documents, but also through allied and enemy documents and records. So we have a good historical documentary record related to this that we can look to. This was really a globalized world in this era. As US troops began to arrive in summer 1917 and in larger numbers throughout the year, these are the modes of transmission, peoples and goods moving around the world, such that between March and June of 1918, the influenza pandemic stretched from Kansas to Algeria to New Zealand. By October 1918, you have closure strictures and quarantine procedures happening in Australia. It becomes global within the year. Yeah. And that's very much like our current moment. And so you can look to some of the measures that were taken in terms of social distancing and other practices of public health as a way to understand the measures that were taken in that era and how they might map on to today. You can also look at a number of other factors. Here's an influenza quarantine camp set up in Queensland, Australia. in 1919, and you can find this kind of record from all around the world. There are amazing images of people flocking away from cities and higher population areas, or being cordoned off from other areas. It happened throughout the US in all the cities, in all the states of the Union. Really, the Great War is the key way to understand this. World War I is a key way to understand this. It exacerbated and amplified modes of transmission, and it also hindered good, honest information being presented to wider publics, wider civilian publics. So it didn't seem like the first stages of the influenza in the first wave, that is sort of from March to June 1918, were so bad. It was often called a 3-day fever. Sometimes it was referred to as the common cold by another name. American military forces, British and French, realized that it was putting their troops out of commission with some regularity, but it wasn't so bad. One indicator was that doctors in the British Grand Fleet, for example, admitted over 10,000 sailors to sickbay in May and June 1918, but only 4 died. Similarly, there were outposts of French troops on the front, in fact, on the Western Front, outposts that had, say, 1,000 soldiers, of whom as many as 600 or 700 might have been hospitalized, but most then get back to combat effectiveness fairly rapidly, within a few weeks. But over time, this gets worse. And so in the fall, this comes roaring back. And this is something we should think about for the present moment, because it seems very unlikely that there will be vaccines, and we are only hopeful that there will be good treatment measures. So we live in a moment not fundamentally unlike the 1918 moment. When it came roaring back in the fall, mortality rates were much higher. But even some places on the front where hygiene was worse and where the ability to do medical interventions was lower, you saw mortality rates that approached 5%. The other thing that you saw, the first indicators of, say, writing on the wall of what was to come, was that in some of these places, like among these French forces, you had mortality rates of up to 5%. And so you can see French military officials in June 1918 are quite worried about their combat effectiveness in the war. But what is maybe one of the main takeaways that historians note, John Barry has suggested this, Laura Spinney in her book Pale Rider, Kenneth Davis, Nancy Bristow have all made similar arguments. The key to understanding this, this moment is that wartime censorship, wartime hyper-nationalism prevented nations from giving improper information or speaking the truth about what was going on. So in fact, the media was unable to fully cover the first wave and into the second wave of the influenza pandemic. So from March to June 1918, and then in fall from August, September into October, because they were prohibited from doing anything that would undermine the war effort. Here you see the Defense of the Realm Act in the UK. This happened in 1914. And it prevented the publication of anything that would undermine the war effort. Very similarly, you saw the Espionage and Sedition Acts in the US. These were dramatic measures, as this headline notes, to punish enemy agents, but the reality was they also hit all free speech. So one of the most famous elements of this was the socialist Eugene Debs was sent to jail for speaking out against the draft in 1918. And this impeded the media from covering the potential harm to the military and combat effectiveness that the influenza epidemic might inflict, but also to give a better and honest information about preventing the spread. Another way to think of it is to think about this moment when the flu becomes weaponized as a possible way of undermining a war effort. It also becomes a key component of thinking about nation states and even racism and borders. And so one of the things that I would encourage us all to think about together are the ways in which the flu today, or the virus today, is reminiscent of the weaponization in this era. So I'll just briefly note this minimization that the US public health officials enacted all the way up until October 1918, calling the Spanish influenza a 3-day fever or the flu, calling it the same old grip, and noting that it really isn't that fundamentally different, until such time as they could no longer ignore the fact that bodies were piling up in the street, and this was something fundamentally new and different. And so from the US Surgeon General all the way down to public health officials in lots of cities and states in the US and in France and in Great Britain, you found this same sort of phenomenon, a minimization of the risks and a sense of let's keep going with business as usual in service of the wartime state. So why was this called the Spanish flu? And what does this tell us about that moment? Well, historians are very clear. You can find this in the press. You could Google it yourself if you do some good hard searching through primary sources. Spain was a neutral in the war. It did not have a Defense of the Realm Act or a Sedition Act. And when the Spanish king, Alfonso XIII, came down with a very bad case of influenza, along with some members of the aristocracy and some leaders of society, the Spanish press, unlike other presses, in May and June 1918, covered what was going on. There were some stories about people falling fainting in the streets, the ways in which this was not a simple flu or not a simple cold like the others. And what happened is that the British press at first started to talk about the flu as a Spanish flu. They talked about the climate in Spain being what had helped generate this, that it came out of Spanish climate and out of hygiene. And they cast aspersions against the Spanish because of their neutrality and their perceived sympathies for the Germans and Austro-Hungarians based on Habsburg family alliances. And so this was very much a wartime, political, rhetorical, and racialized move to call it the Spanish flu. And it's really fascinating. It has some deep resonance with what we've heard lately in terms of the Chinese flu or the Wuhan flu. And one thing I would add that's interesting about this moment is that the Spanish called it the French flu because they were convinced that the French were the problems here, and French migrant workers moving into Spain as part of the war effort were the ones who brought this disease to them. Other nations, the Germans called it the Russian pest. Other nations called it different things along these lines. And the point being that they were sort of weaponizing the flu to other their enemies in often political and racialized terms. And you can see this most notably because if you look at any of the public health literature as of October and November 1918 in the US and in the UK, you find a clear consensus that the flu did not originate in Spain. They knew very rapidly that it didn't come from Spain, but they continued to call it the Spanish flu. Why? Because of the wartime and because of the way that war propaganda operated. So the second wave of the flu came in summer and fall 1918. We know from the naval intelligence, US and British naval intelligence, that they're watching, as in Switzerland in particular, but a number of other countries in Northern Europe, suddenly a more virulent form of the flu arrives. They had been happy to see it seem to go away with that seasonal way in which the flu seems to operate in hotter months in June and July. And then suddenly, late July into August, here comes the flu, but it's a lot worse. And you're seeing 50 or 80% of the population down sick in places like Switzerland, in places that have good health infrastructures. And so you saw entire posts of military posts in Switzerland out sick. So American and British naval intelligence officers write secret messages back to their commands, and they say, watch out, this thing is coming. And they're waving a sort of red flag. The red light is blinking. Watch out, it's getting a lot worse. But the US and British responses were to continue to clamp down and not publicize, not take proactive measures. The best example of this, if you all have been reading about this, you already know about it. I won't belabor it too much, but be happy to take some more Q&A. Is the September 28th, 1918 Philadelphia Liberty Loan Parade. In this parade, the largest to date in the city of Philadelphia, you saw a hyper-patriotic celebration of the war effort. You're within a few months of the end of the war, a really critical stage ramping up. The US is trying to sell Liberty Loan bonds, Liberty bonds, and they gather all kinds of people. But the local health commissioner, the city mayor, they're aware that there are a rising number of influenza cases that have come in, that have begun in both Boston and Philadelphia, and that these are, they make claims that these are being handled by, quote, modern nursing, and contained to military barracks, to sailors and to soldiers, but they're seeing rising cases happen. So this is the classic example that public health scholars and historians point to. Holding this parade very clearly infected and killed thousands of people. Within a short week, you've got 2,500 people have died. Within a few weeks, 4,500 people have died. And at its worst, in Philadelphia, you had 700 people dying per day. So many people were dying in the city of Philadelphia that the hospitals were overwhelmed, and that the clergymen who were driving the carriages to pick up the dead couldn't keep up with them. You saw suffering on a scale, an urban, modern, industrial scale that you hadn't seen in American society. One data point here is that in 1880, the US was majority rural, but by 1920, the US was majority urban. And these high density, higher population areas were incredibly hard hit, particularly on the East Coast of the US. And so you had these families suffering terribly. And one of the elements of this narrative is that that's important to play up is that public health officials continued to minimize even as this was going on. They said, we've got this under control, that if you just take normal precautions, they didn't need to have major closure policies and other kinds of proactive measures that we would call social distancing today. Other cities do other things. Here's an example of Philadelphia. Halt the epidemic, stop spitting everybody. But he's not wearing a mask, and this isn't a claim to socially distance or close things. But whereas you will see, and we did see, much more proactive social distancing measures in other areas of the US and around the world. One quick example a little bit later about what's going on economically, because this is a major concern today. Here comes from the Wall Street Journal. In some parts of the country, the pandemic caused a decrease in production of approximately 50%, and almost everywhere it has occasioned more or less fall off. One of the key elements here that historians point out that I've seen in my own work is that there was no such thing as normalcy as this goes on. So by November 1918, as the war is about, an armistice comes in November 11th, you see lots of war industries with 50% or fewer in their workforce showing up any day. Either the folks were sick or they were afraid. And in fact, when there's a pandemic, it's very hard to keep things open, even if they are ostensibly open and pushed open by city officials, state officials, or the federal government for that matter. It's also important to note that the Wilson administration issued very few guidelines up until the middle of October 1918, and the Wilson administration largely ignored the problem. In fact, Woodrow Wilson had his own doctor and public health officials say he should probably stop troop transports across the Atlantic as of September 1918. He did not. His general suggested that he continue the practice of sending troops abroad, even though he knew a lot of them had influenza. One data point that we don't have good photographs for, but lots of the social history suggests is true, is that when US troop transports arrived in France in fall 1918, they were met by ambulances to take off the sick and the dead. Here's an example of the St. Louis Red Cross Motor Corps, their ambulances and teams awaiting influenza patients in 1918. This, again, these are the kinds of scenes we want to avoid as much as possible in the present and in the future, and they're very much indicative of as this got out of control in the fall of 1918, the cities that were most proactive did the best, with the hardest closure procedures earliest, and the ones that kept it on longer. The ones that did not, did slow or intermediate closures, didn't do as well. We'll talk a little bit about that briefly. So if you've been following this, if you've been reading the history, you may have a sense of this. I'm going to walk you through it, and we can go into more depth if you want in Q&A. So places like Philadelphia, look there on the left, right? This is the headline after the Liberty Loan Parade. You don't see really anything of much substance there related to influenza. You know, fighting men of the Navy thrills vast crowds as they march along Broad Street, the Philly Inquirer. Scientific nursing halting the epidemic. Deaths now on a decreasing scale. Cases average only 1,875 a day. That's an astonishing number. And yet they were still minimizing as you move through that in Philadelphia. So you've probably read or have some sense of this, but I'll talk to you about it. So Philadelphia comes very late and has some of the worst mortality in the US in terms of their proactive measures. St. Louis is often held up as one of the best in this. The public health leadership in St. Louis, the main public health leader there was the son of a U.S. Civil War surgeon and had always had a fascination with communicable diseases of various types. And so he was on the lookout for this, and was empowered by the city mayor in St. Louis. And at this point, both of these cities are top 10 cities in the U.S. He was empowered to put down strictures rapidly against any kinds of spread. And so what happens in St. Louis is, here's another visualization of that. What happens in St. Louis is that when the first cases arrive in mid-September, St. Louis clamps down and first suggests no congregating of people over 10 or 25 people. And then as soon as the first cases are found in the barracks near St. Louis, they immediately close schools, close theaters, close restaurants, close virtually everything. And then the very next day, then they close churches. And that has this kind of effect. Philadelphia, as we said, had this huge parade, September 28th, and watch that, just look at that spike up there right after that parade. Same here, right? And the interventions come late, and they come slowly. Pittsburgh is another case that's like this. New York is also had a spike quite similar to Philadelphia's. Pittsburgh's is interesting. I was just looking at the sources in preparation for this, looking at their newspapers reporting. One thing that's interesting is Pittsburgh took a, quote, layered approach. So they didn't close schools for a long time, partly based on a Catholic school, parochial school lobby that wanted to keep them open. And the argument that public health scholars make about this, the Journal of the American Medical Association has a great article on this, is that layered approaches don't work as well. And so the quick strictures, if you're looking at the St. Louis case, look, St. Louis suffered a lot. It's not like they did perfectly here. But if you look at the St. Louis case, their strictures prevent the kinds of peaks that you see in cities like Pittsburgh and Philadelphia and New York. And so the layered approach, meaning slow closures of various types over time, didn't work as well as a single move closure. Why do I have Pittsburgh up there? What happened there? You may know. What happened in Pittsburgh in the middle of November was their special interests, a combination of primarily 2 or 3 groups: restaurant lobbies and clergymen. But also those trying to sell alcohol and tobacco. And remember, we're getting close to prohibition. About 33 states at this point have state-level prohibition, but all the other states, a lot of people wanted to, when they were out of sort of quarantine-type procedures, they really wanted to have some vices. And so those lobbies, the lobbies both for clergy and opening churches and for restaurants and other kinds of sales, department stores, push Denver to open prematurely. And the case here is one that we should all be cognizant of because there's a rapid leap up in terms of mortality after they begin reopening. And so what public health scholars and historians of science suggest is that you should really let data and disease, not special interests, dictate when to open, or psychology or sentiment. And there's a lot more to this. There's a lot of other cities. Bet you didn't know that Babe Ruth got the flu. Gotta have something fun and light in here, and I'm a huge baseball fan. So East Coast cities near military and port facilities felt some of the worst wrath of the flu. As I said, Boston, Philadelphia are high on that list. New York as well, because they're transmission hubs for the war effort, and much easier to have that coming and going. But Babe Ruth got it in the fall, as you see here. It's documented in a great new book called War Fever about Boston and the influenza pandemic and also baseball and anti-German sentiment. So Babe Ruth spoke German, had German origins, his father was German, and he hid that, Herman George Ruth. He much preferred Babe. But he got the flu. It doesn't seem to have hit him too hard. But one of the things that's really important to take out of this moment and to think about historically is that the flu in this era hit young and healthy people hardest of all. That the people who are dying the most of the disease, up there on the left, that's Dartmouth College, were young, healthy men in particular, and women, and they were dropping dead fast. And the Pacific Division of the U.S. military, who were were doing lumber work for the war effort. One report suggests that the top lumberjack, someone all of the men on the teams looked up to, died within a day of the influenza epidemic. The strongest, toughest person in the crew. All American football players died. So unlike our current moment, this flu seemed to catch the young and healthy, which spread fear very rapidly and also was a concern for military officials. Keep us moving through this. There were staffing crises, of course. Here you can look at the National Archives to keep the U.S. on a war footing. It was a big problem that they couldn't meet, that they couldn't take account of ways in which officers and other folks were out of commission to manage food administration and to keep supply chains going. A very similar problem today, potentially, if a lot of people get sick and are unable to operate in supply chains. Again, then as you move through, you see the rise of different kinds of social strategies and public health strategies like masks and mask wearing. In the fall of 1918, it becomes very popular as a recommendation, and then in some cities, a mandatory move. Here you see the Seattle police all in masks, obviously the Red Cross in masks there. Typical urban scenes in fall 1918. Here on the left, you see a train conductor saying that that guy without the mask can't get on, that's not permitted. In some cities, they argued for public health processes called ventilation. So they took the windows off of public transit to ventilate the areas. They were aware that germs spread through surfaces and through sneezes and droplets. And so they wanted to prevent that as much as possible. In cities like Portland, Oregon, they sent out public school teachers who were no longer teaching to teach sort of basics of home economics and home cleaning within homes, and to watch if people were sick, and to help the police in putting up quarantine markers on doors to say this place is quarantined, don't go in or out. Other initiatives that were taken in that era were open air court. So before court proceedings were shut down, you saw them being done in the open air. It gave people more confidence that there could be health. They're obviously not 6 feet apart, as we would talk about today. They're not yet wearing masks, but there was some sense that being outside, the so-called sunshine method, was helpful and useful. And we've heard some things about that recently too, that people on walking paths and bike paths, the droplets don't tend to transmit very well. There isn't great evidence of transmission in that way. On the other hand, you could imagine these folks shaking hands and being in such close contact, they would be clear vectors of disease. Similarly, you saw open air barbershops begin. Here you have a little bit more distancing happening. The barbers have masks on. Again, these sorts of processes are things that I imagine we may see when we see reopening in the US and around the world. Here indoor in Cincinnati, so they didn't do open air in Cincinnati in the fall. They did indoor, always masking of barbers and other folks. I could have pointed out lots of other photos of similar things, say within department stores when they did reopening or phased opening. Here's college classes being held outside. I think this is University of Wisconsin. It's from the UW archives. Again, in the cold, outside, this time, no masks. The real problem in this era was a set of incoherent messages from the top down. The Wilson administration didn't issue statements early or often. People didn't know what advice to take. Here you see advice like the flu travels through the mouthpiece of the telephone. Constant and continuous smoking would stop the flu or stall it. You saw the Surgeon General issue vague and misleading kinds of statements, including there's no cause for concern if precautions are observed. Others argued that Vicks VapoRub would be a good help. Hard alcohol was thought of as something that might be an assist for people. The US Surgeon General also said that modern citizens were over-conditioned to rely on and be coddled by modern medicine, and that he thought people should just, quote unquote, sort of succumb to the disease and get over it. In the bottom right, you see an attempt at vaccines that didn't work. So there were lots of efforts made and a lot of bad information given. Proactive policies and information were key, very similar to today. I mean, it's really astonishing. Theaters, churches, schools closed. You know, this is just a sample from around the US. All sorts of places. And the very similar processes were followed in the UK, in France, and elsewhere. We could pull from the press almost anywhere and find this. There was also a lot of pushback in that era. I wanted to briefly note the story of Oregon and the Pacific Northwest. Oregon and Portland in particular is a case, I wrote about this in an op-ed for the Washington Post, where you see an intermediate case. Portland came a little late to closure policy, had too many chefs in the kitchen in terms of public health, but overall did well tamping down the peaks, but it prolonged the duration of infection, illness, and death. And so for Portland, the period expanded into well into 1919, but it flattened the curve in terms of the overall peak. In Oregon, we see a clear transmission line through the U.S. military coming by train transport to Seattle, and then down through Fort Stevens into the Astoria region, and then over to Portland by troops who were headed to Texas. Phased reopenings are a really interesting thing for us to think about together. How should this work? How should it be dictated? The flu bans were raised all over the place. Eventually, there was a lot of pressure to do it, but really effective public health mayors and city leaders usually pushed back once bans were on to not do so. Here's a great image that I love that seems very relevant today. Save yourself from influenza. So when the federal government is issuing some recommendations, you saw state boards, like here's the Virginia State Board of Health taking action. So pushback, I want to just begin to wrap us up. There were pushback, there were protests, and there was reemergence of disease. At the end of the fall outbreak was the November 11th armistice parades, when people got together and gathered in mass. As you might imagine, like the Philadelphia parade, you saw possible reemergence. San Francisco's anti-mask league, there was just some NPR reporting on this, is one of the most famous and interesting of these cases. They said that it was a question of liberty, that Americans be allowed to not wear masks if they don't want to, that mandatory mask ordinances were an infringement of their civil liberties, and exactly the kind of thing that Woodrow Wilson had said the US was trying to prevent in making the world safe for democracy. So they turned the language of the Wilson war effort against the Wilson administration in trying to push back on this. And I have some great documents from the mayor of San Francisco who said, no way, our disease and deaths are down. We don't want to stop the mask effort. But in fact, in places where masks were taken off, what we saw in the data is that there were upticks in infection and death. Now, whether or not they were directly related to infection is a different question. It seems unlikely since these were just gauze masks. But historians of science suggest that what was going on was a kind of social psychology at work, that people wearing masks were taking more precautions and seeing that in others and signaling a wariness of infection and disease. So let me wrap this up with a couple main highlights. One of the things that you saw out of this period, coming immediately out of this, were some cyclic recessions. So there's a readjustment recession in 1918 and 1919. There's the rise of xenophobia and racism. In 1921 and 1924, you see large immigration restriction acts in the US. There's a sense that business as usual in the US after the war and after the influenza was something only for Americans. And it seems particularly resonant in this moment with immigration restriction moving forward. So two key insights: where there were cancellations and postponements of large events, people did better. They slowed the spread. Most Western nations that were involved in the war, they attempted to control information, they minimized risks, they hid real data, and they performed in these ways that were deeply problematic in terms of getting good, honest information or speaking the truth to wider publics. Result was, you can see this in lots of historical literature, that most citizens were ill-informed, right? And so they had those kinds of questions. I just flagged one there, that flu was transmitted through the telephone. And one of the heart-wrenching accounts, one of the most heart-wrenching accounts that I've read, is one of some citizens ignoring other citizens, other folks on their block, because they were afraid they would get the disease. Healthy young people who knew that other healthy young people could get sick and had been dying, and they didn't want to help. They stopped volunteering. So because of bad federal and state government information early on, and out of fear, you saw real problems. Honest information obviously is better, than lies or minimizing risks. It's pretty clear from this case. We could say it's ethically clear, but it's very clear from this history. The other thing that's really amazing in this moment, the St. Louis case suggests, but also the Philadelphia negative case suggests, the main action was at the local and state level, that mayors, governors, and health officials. It wasn't at the level of the federal government, at any of the governments that were involved in this. So I've got a couple other recommended pieces if you want to watch some great coverage. The Influenza 1918 on PBS American Experience is great. Here's a few books: John Barry, Laura Spinney, Nancy Bristow, Kenneth Davis, Susan Kent. They're some of the best here. And then one last thing that I wanted to note is that the importance of historical analogies, that even though we can't map on one-to-one what's going on in this moment with the influenza pandemic of 1918 and 1919, it's incumbent on us to look at these hard facts of the past and see what we can apply sort of pragmatically, what can we tinker with to try to make our world better in the present. And history provides this evidence as well as any, and this case in particular is a unique one because very rarely does history offer such clear lessons and insights that map on so well to a contemporary challenge. So I'll leave it at that for now, and let's take some Q&A.
Great. This is the disembodied voice of Tim DeRoche coming over. Chris, thanks for a great presentation. You sort of answered the question that I was going to throw out initially, which was the pushback, the anti-mask league. I'm curious. Well, actually, it's kind of two parts. Was there a precedent in this country prior to this for a large-scale public health campaign or public health education? And were those pushbacks, were they concerted efforts, sort of grassroots, or were there people who were fueling them who had larger interests? Because it seems like some of those folks are the same people who were very against jumping into the war.
Yeah. Good question, or nested question. So there were a number of major pandemics spreading from Europe in Anglo-America. 1732, 1781, 1889 to 90 is a good example of an outbreak. You saw that in one of the pieces of media that I threw up there. So there were a number of these major pandemics that American sort of public health officials at least would have experience with. There was nothing on this wide of a scale, and because of the ways in which globalization had operated for the first 2 decades of the 20th century, it was very different in terms of transmissibility questions. That said, the pushback, the folks of the pushback, it was very, the anti-mask league, for instance, maps on well with the rise of a explicitly America First group that were xenophobic in California. America First develops as language in Republican politics in the late 19th century, in fact, and becomes in the 1910s, actually both Woodrow Wilson and Charles Evans Hughes in their presidential campaigns of 1916 used the term America First, and they used the term in pushing back against so-called hyphenated Americans. It was a move for Anglo-Americans or Native Americans to be the core of the American population. And so there's a very neat overlap between those who oppose sort of federal and state overreach and this kind of logic of America First or anti-immigrant sentiment. So that you're exactly right in terms of that set of politics and principles.
Okay, we've got this is great. We're starting to get all the all the questions fueling in, because otherwise I have to pull them out of my back pocket. Lise Brown has a question for you. Was the economic impact of the 1918 flu, or with the economic impact of the 1918 flu, I would assume the poor became poorer and received no relief money.
Right. So at that time, the major difference in comparison is apples and oranges today in terms of the federal government and relief systems. All the poor could rely on in 1918 and 1919 were the charitable operations of civil society, of churches and other what de Tocqueville would call collective society of joiners kinds of operations, community groups, church groups, and the like. So that's one piece of it. How did you rely on? How could you get aid? And clearly, like today, the closure policies deeply affected those who were the most at risk, particularly those dwelling in tenements in urban areas, those in the highest density population areas and low hygiene, low sanitation areas. But as you saw in some of those images, lots of sort of regular lower middle class workers were going to work. We're seen as essential workers. So there's that. It's also a shorter span. So the closure policies are largely October into November 1918. We'll see what happens today. And so economists actually have studied this fairly well. There's a couple studies that suggest that areas that were more severely affected by the 1918 flu saw sharp, sort of persistent declines in real economic activity. But that cities that implemented early and extensive, what they call non-pharmaceutical interventions, which means social distancing, closure policies, that kind of thing, they actually suffered very little economic effect over the medium and longer term. So within 4 or 5 years, economists have shown the pandemic of 1918 to 19 really did not have that much effect. That people, once they were not afraid, there wasn't very much disease or any, they were going back to work and the economy was doing well. That's when you begin to get the roaring 20s. The cities that intervened early and aggressively experienced relative increases, in fact, in real economic activity in that period. So taken together, the findings of economists suggest that pandemics do have big economic costs, but those kinds of interventions we're talking about really lead to both better outcomes and to lower mortality and disease. And that's a really important lesson from this moment.
So what can we learn from what ended or at least controlled the 1918 flu? I don't think you really touched on that.
So well, one is that it burns through populations whether you like it or not, I think. All of the histories here suggest that it's very hard to completely control this transmission. In that era, you had much more, let's be honest, primitive public health knowledge, right? There wasn't viral knowledge of this sort. American scientists find this virus in the 30s. So, you had, in this era, you had to rely on social distancing and non-pharmaceutical intervention, and you had to rely on good public health information and proactive government policies. So what got it under control is proactive policies. It's quarantine, it's tracking and tracing, it's making sure that there's less spread and getting good data on disease and hospitalizations. Also remember that there was much less of a sense in 1918 or 1919 that you could rely on your government to help you. So a lot of people stay home when they're sick. And there was much less of a sense compared to today that the public health infrastructure should be what should help you. So people wouldn't necessarily go to a hospital or go to a doctor in this era in the way that we now think of that as de rigueur. You just would have to go if you're really suffering. So it's those kinds of public health and public policy activities that get it under control relatively. And then I would add, I'm not an epidemiologist and I'm not an MD, but in the literature on this, what's interesting is the end of the war and having less troop transport and global transmission of goods and peoples coincides with seemingly a mutation of the virus so that it's not as deadly. So after February, March 1919, you see a lot less of bad infections, disease leading to death.
So looking at the St. Louis data, could you provide some insight into the second wave and why it peaked so much higher than the first? And do you believe something like that could happen in the Portland area today?
Yeah, so the thing that makes me the most nervous today looking at the lessons of this history is that premature reopening clearly led to disease and infection that then had longer duration. The St. Louis case where they clamped down early and stay clamped down clearly prevented much worse disease and death. They were one of the top 5 in the US and in the top of the top 10 cities because they were early to closure, right? They closed weeks before the Philadelphia parade. And then second, despite all the special interest pressure to reopen, St. Louis didn't do it. Could that happen in Portland? Could that happen in the US and around the world? It seems very likely. I mean, we just heard the CDC director in the US say, beware a second wave. So the point of these lessons is that, say, Portland was, the disease comes to Portland in October, about October 4th, 1918, and really takes off in mid-October. Remember, by the 2nd and 3rd weeks of September, St. Louis is taking proactive measures. So what's the lesson there? If you see other cities or other countries where it's cropping up, then that's a great moment to take proactive measures. If you delay, or if you do the layered response that we saw, say, in Pittsburgh, they're very likely to have bad outcomes. I mean, that's clearly what this history suggests, at least.
So do we have any firsthand accounts from Oregonians about the 1918 flu, and perhaps some from people who are even maybe alive today or died in maybe the last decade?
We do. So there's the Oregon Encyclopedia has a great brief essay on this, actually on a few different cities. And then I cite here, there's this Influenza Encyclopedia run out of the University of Michigan, which has been updated several times. And there's a fantastic essay in there, a long one on Portland, with lots of primary sources that you can pull from. The OHS, the Oregon Historical Society, has some accounts. But the one that stands out to me, I wrote about it in an op-ed in the Oregonian, is, in very brief, is that the city of Coos Bay had only one undertaker in 1918, in fall 1918. That undertaker pretty rapidly got influenza and was laid up at home. They ran out of coffins, and in particular, a group of young children was hit. Almost all of them died, and the people in the town didn't know how to make child-sized coffins. They were just kind of at a loss. And there's several accounts from newspapers that are just searing, heart-wrenching accounts. You know, it was really bad. And actually, the state of Oregon, you know, we're not sure if these numbers are how accurate these are, but the state of Oregon fared a lot worse than a number of other states, particularly because high population density areas like Portland didn't take action early enough. So you saw mortality rates in Oregon seemingly closer to 2 or 3% as opposed to 0.66% throughout the US.
So as a historian, here's a good, George Olson has a good historian question for you. There is very little space devoted to the 1918 pandemic in US history survey texts. And do you think our current pandemic will change that? And secondly, is there any evidence that the more lethal second wave resulted from a mutation in the virus?
Good questions. Yeah, so I am leading a roundtable for the Journal of the Gilded Age and Progressive Era and the Society for Historians of the Gilded Age and Progressive Era. We're trying to get out all kinds of coverage on this. And we were shocked to find how few articles and essays have been published in these major journals, specialized journals, just for historians of the period. And one of the top scholars said, you know, I always teach about influenza in one paragraph in my survey class. I think that's changed radically. I mean, right now I started my US history survey class with half of a class on the kinds of stuff that we're doing today. I always teach it because I was fascinated by the flu's impacts on World War I, which is what I've studied and written a lot about. But you know, you don't see it playing much of a role in our understanding of the World War I era or the 1920s. You know, as I suggested here, there's a real connection, I think, between the return to normalcy logic of the election of 1920 and the immigration restriction with the devastations of the flu and combined with the war. On the other hand, it's very hard to disaggregate the war from the flu. The war is ending in fall 1918. The flu is ramping up in that same period. And so, you know, what is more causal in terms of the dislocations, the lost generation, and the challenges of the period and the time? The second question was what? I'm sorry.
Is there any evidence that the more lethal second wave resulted from a mutation?
Right. So there is some evidence about that. The genomes have been found and categorized. There's not a good sense of what the evolution is from spring to fall 1918. So what I described was the increased mortality but there isn't we don't know for sure what made it so much more problematic then. It looks like, as we've heard currently, there are lots and lots of small mutations that are always happening to viruses. And so which of those was most significant is a challenge. So some of the genome that's been sequenced comes out of Alaskan grave sites and French grave sites. And I don't know that there's been that much work to compare them on the time of death, likely time of death versus viral mutations. Historians of science don't tend to emphasize that. There's so-called disease model isn't as prevalent in work recently as it used to be. But I wonder, and I think you're right to surmise this in the question, that we're very likely to get more research on these kinds of questions, putting scientists, geneticists, and historians in the same conversation.
I'm going to do one more question. I think we're going to sort of wrap it up. You brought up the issue of not being able to really disconnect the influenza epidemic from the war. And I'm thinking about this. I mean, we were thrust as a nation into this, into globalization in an interesting way. One out of conflict, and then looking at how the influenza epidemic spread globally. How did these two things, and maybe there isn't, maybe they didn't, but did these two things have any bearing on Wilson kind of coming back with the League of Nations?
Yeah, so there's good question. Yeah, I think so. Wilson actually, we think, got the flu while he was in Paris in peace negotiations. He's holed up in his hotel for several days, and he is a bit disoriented after that in ways that seem to confirm a flu diagnosis. And there's an argument by some Wilson scholars, and I don't know how much faith to put in this, but I'm just presenting it based on your question. Some Wilson scholars, that some of the concessions that Wilson makes, say in terms of reparations, that he wasn't prepared to make earlier, were a product of having gotten the flu. And then he had a weak heart to start with, and in fall 1919 he has a stroke as he's campaigning across the US in favor of the League of Nations. So his weakening literally may well have been because of getting influenza during the Paris peace negotiations. And he's the first American president to go abroad to negotiate a peace treaty. In terms of the broader dimensions, I think the flu clearly plays a social role in how Americans think about their role in the world in this era. And so coming out of this moment with all this devastation, right, 675,000 dead, and the majority of American combat losses come from disease and flu, not from actual combat. You have a sort of a disease origin story for a kind of turn inward in the 1920s, that isolationism, that border control, that nationalism, that immigration restriction fit neatly with worrying about what might be transmitted in terms of diseases, and also about models for self-sufficiency of the nation state, a kind of vision of American exceptionalism. That's really important to understand what's to come. And whether or not that's more war than influenza is sort of irrelevant to thinking about how they're enmeshed in each other. And that's really the present moment too, I think, that what's crucial for us to understand now is the decisions that are being made about public health, public policy, foreign policy will all be seen by historians later as an enmeshed set of decisions, that none of these are preordained, that one could decide to let the disease ravage a country for whatever reasons or not, to have a much longer closure policy and prioritize health and safety over the economy. Questions of immigration restriction, right now, map neatly onto immigration restriction in 1919 and then 1921 and 24. Or the Red Scare comes out of this. There's a lot of steel strikes in 1919. Some historians, social and labor historians, suggest that because workers had to keep working for the war industry, that they were much more activist as the war ends. And so you saw some of the largest strikes in US history in 1919. So I would suggest to listeners thinking about this, perhaps there will be more labor activism as a result of this. You think about who and what counts as essential and who will suffer more. As someone said earlier, it's always unequal in any society. But this kind of moment, a crisis, casts in sharp relief public policy decisions and who bears the burden in a time of crisis and emergency.
That is great. That is a really wonderful way to wrap this up. I'm always thinking about that quote from John Steinbeck of how do we know it is us without our past? I'm not a historian, but I'm a big fanboy. So I appreciate when somebody can give us, you know, the telescope, the mirror, the kaleidoscope to go back and look at something that is also right in front of us. And I think you've given us some really wonderful analogs and some great resources. And hopefully we can revisit the topic. And for anyone out there, we have been recording this. We will post it to YouTube. If you want to pass it on, we should probably have it up later in the day on WorldOregon's YouTube channel. And Chris, I want to thank you, and I'm going to toss it back to Derek, who's going to wrap up things for us.
Great. Thank you, Tim. Thanks, Chris. Fabulous presentation. And yes, several people asked, we will continue to have things on not only what is currently going on with COVID-19, but how history influences the decisions we're making and where we're headed in the future. So if you missed some of our previous programs, as Tim said, check out our YouTube page. A huge thanks to the Oregon Historical Society for co-presenting that. If you have the ability to do so, please consider renewing your memberships, donating to World Oregon and the Oregon Historical Society. It's a very challenging time for nonprofits like ours, and your support is crucial to that. Our next program coming up is Countering Extremism in the Age of Quarantine, a fascinating discussion with Eric Ward and Randy Blazak. That's Monday at noon. It is coming close to selling out, so I encourage you to register on our website. We will also have a long reads club, which our young professionals lead, but is open to people of any age, Sunday at 11:30. Both those on our website. Chris, a huge thanks again for your fantastic presentation and for continuing to teach all of our citizens down at OSU. It's great to have you helping out to everybody there. And just thanks everyone for joining us today.
Thank you all very much. Yeah.